Biceps tendon injuries. The first is a subluxing bicep tendon. Subluxation or dislocation of the biceps tendon, the long head, can occur within the bicipital groove if there is tearing of the transverse humeral ligament or the portion of the subscapularis tendon that stabilizes the tendon within the groove. The mechanism most often associated with dislocation of the biceps tendon is a rapid and abrupt lateral rotation of the humerus while the bicep is under tension. The patient complains of anterior shoulder pain located over the tendon in the bicipital groove and a painful popping or snapping sensation as the tendon slips in and out of the groove during medial and lateral rotation. Tenderness is present directly over the biceps tendon. Another biceps tendon injury is biceps tendinitis. Tendinitis can result from repetitive overloading and friction as the long head of the biceps passes through the bicipital groove and under the transverse humeral ligament on its way to its proximal attachment on the superior glenoid labrum. Traction of the tendon's attachment on the glenoid labrum can also occur with forceful contraction during deceleration phases of throwing. In cases of glenohumeral instability, the biceps and subscapularis may be overloaded as they are called on to provide more of the anterior restraint to the glenohumeral motion. This can cause inflammation and pain within the substance of the tendon and at its attachment to the superior glenoid labrum. Biceps tendinitis occurs frequently as an isolated injury and is typically associated with a shoulder impingement syndrome. Signs and symptoms may include diffuse anterior shoulder pain with point tenderness specifically over the bicipital groove and proximal tendon. Pain can be elicited with passive stretching of the biceps tendon and with contraction of the biceps while resisting supination. The throwing motion may also be painful, particularly during the late cocking and acceleration phases.